Is Pharmacy Tips from Pharmacy Tech. And today we're going to talk about doctors and their prescriptions because a lot of times in retail pharmacy, when you are having to wait a long period of time, it is because of doctors forgetting to either write or type something, or something's completely missing that should have been there to begin with. You would think in a digital era, doctors would just learn to look better and not miss anything. So I'm going to teach you ways you can understand if you're getting everything that you need. The first and obvious thing is make sure they actually sign the bottom. If it is not signed, it is not legal tender or legal prescription, and you'd be surprised how often this gets missed. The next thing is the prescription itself. You don't need to know what BID, BID, TD, QD means. That's just the frequency. What you need to know is the medication that you're looking for, the doctor talked about on the piece of paper. And like in this medication that's missing, there is a quantity, like an amount. 1 month is fine, 40 tablets is fine. Just make sure that it's on there, because if it's missing like this, we're gonna be like, okay, so how much should we fucking give you? The bottle? And that's not no. And while yes, the pharmacy can assume with this type of prescription, if it is something like an insulin where it is an as needed, as adjustable dose, we are gonna need something more than this to make sure that you're getting it safely and you're getting the most that you possibly can for your prescription and for your situation. And to piggyback off of that, if you are gonna be on something for a long period of time, ensure they put on refills. It doesn't matter if you've been on it before or it's new for you. If you are gonna be on it for more than one time, make sure they put this on. For some reason, I don't know why, they forget to put this on. And then in the next month or next cycle, the patient's gonna be like, wait, I just saw the doctor like a month ago or a week ago. Why the hell do I have to see him again? Yeah, why do you have to see him again? Because he freaking forgot. And my last tip is whatever medication you are written for, especially if it's new, ask if it is covered or there is an assistance card or program that can help you with it. Because a lot of newer treatments only have the brand name and they probably have an assistant card to help you with the cost. And if you are coming from the hospital from an ER doctor you're probably never going to see again in your life, God forbid you're going to be in the hospital again, make sure and ask the receptionist or the doctor if what they're giving you is actually covered. Because the worst thing that you can do is, break an arm, break a leg, go in there for like a high dose painkiller that's unfortunately not covered. So hopefully this helps you out. And remember, being educated can help you make sure that those people, the doctors, whoever's writing this crap, stays accountable too.